India is in the midst of a crisis. The country has seen a new surge in COVID-19 numbers. Today, this Monday, it's recorded close to 353,000 new cases. This is a new global high for daily coronavirus cases for a fifth straight day. The United States, for its part, leading international efforts and offers of additional support to India. For the latest, I'm joined now by eNCA's India correspondent, Rebecca Bandun, as well as Dr. VN Jha from the National Corona Helpline of Project Step 1 India. First off, Rebecca, good afternoon. Welcome to the Midday View on eNCA. I mean, the numbers keep surging, and I've just read out a number of just under 353,000. It looks like the COVID-19 surge in India is not stopping.
Yeah, this is what doctors have really been worried about, and everyone has been worried about, that the numbers would continue to rise over the past few days, and they have. And there are still concerns that this second wave of the virus might not peak until next month. And it really is overwhelming the country's healthcare infrastructure. There have been those huge shortages of oxygen, particularly in New Delhi, where patients are actually dying as a result of not being able to get access to oxygen. Hospital beds are full in the capital, in many other parts of the country as well. It's very difficult to get access to a hospital bed, including in Mumbai too. And even there are shortages of medicines as well. So what doctors and everyone is really worried about is if these numbers still continue to rise, what's that going to do to the healthcare system? It could even, they say, collapse essentially, because it's already really at the brink at the moment. But really, this is a crisis. There are countries that have pledged support, of course, including the United States, Britain, Germany. They are going to send in essential medical supplies. But this is really a very, very urgent matter for India, and patients are dying every few minutes in Delhi. So really, this is a problem that needs to be tackled urgently, and many people criticising the government, just saying it's left things too late now at this point in time when it's reached such a crisis point.
Yeah, now Rebecca, please stay connected. I want to bring in Dr. Jha as well, who's probably hearing us as we are talking. Dr. Jha, the healthcare system in India currently seems to be buckling under pressure. Is that a fair assessment due to the surge that we've seen now?
Oh, yes. Very good afternoon to you and to all my friends in South Africa, I will call it. See, what problem is here is a population. Officially, India is the second populous country in the world, but practically, we are the most populous country with 1.39 billion of the official figures of Indian, plus about 40 million of the immigrants, illegal immigrants who have come to India. So we are the most populous, and there is a very serious... See, it is not come all of a sudden. There were indicators. When the new variants of the virus had emerged in UK, in South Africa, Brazil, and many other nations, there were already hints that UK variant had already landed up in India, and that had about 70% more infectivity. So we should have got alarmed at that time itself, but we didn't.
Yeah, so it's taking. Sorry, Dr. Jha, the line is not great with you. I apologize. There's a bit of a connectivity. The bandwidth where you are is not playing ball with us. You keep on breaking and freezing. But the point is, Rebecca, that the government is being criticized that maybe the way it's handled the coronavirus pandemic has not been optimal. But we know that there's been some vaccine rollout. From what you hear and what you've seen and what you've observed, what can you tell our viewers? Where have they got it wrong? Where's the problem? What has led to these big numbers like we're seeing?
That's what everybody's asking. What did go wrong? Because actually just a couple of months ago, if you look at India's numbers, the COVID-19 situation seemed to be relatively under control. And now this has suddenly hit India. But many experts are saying, well, there were these warnings that, we saw the second wave happen in Europe and so on. And India just had opened up too much. It had that very, very strict nationwide lockdown last year. Then steadily, the Indian government allowed everything to reopen, allowed the economy to reopen. And after that, there was this sort of coronavirus pandemic fatigue, and people did stop following social distancing practices. A lot of people stopped wearing masks. They were going for huge weddings, going out, going to work and everything, and really just kind of forgot about the virus. And then obviously it has led to this kind of situation. And also the government has been criticised because there have also been these election rallies that have gone ahead in recent weeks with large crowds where, again, the COVID-19 guidelines are not being followed, and those include election rallies that were addressed by Prime Minister Narendra Modi himself, and also the Kumbh Mela religious festival this month, where there were hundreds of thousands of pilgrims gathering on the banks of the Ganges, again not following any of the COVID-19 precautions. So a lot of people are now blaming the government for not taking action, for allowing things to reopen so quickly, for allowing such things to happen. The Indian government, Narendra Modi, last week said that he didn't want to impose another nationwide lockdown because of the economic impact. But there are states that have gone ahead with imposing their own lockdown restrictions, like Mumbai and the wider state of Maharashtra. Delhi's also got a lockdown in place. Karnataka in South India has also now announced that it will start a lockdown as well. So state governments are taking those measures, but the Indian government hasn't, which is really raising a lot of questions now when the healthcare system and a lot of patients are facing this huge crisis.
I hear they're running out of beds and they're staying at home, those who are sick, and there's been an issue of oxygen supply, hence the offers of help from the likes of the US, Germany, Britain and elsewhere. The death toll from the COVID-19, well, we talk about 353,000 new infections today, or reported today, Monday. What can you tell us at this hour about those who are succumbing to the disease? What are the numbers looking like?
Yeah, so the numbers keep on rising in terms of the death toll as well. Yesterday, more than 2,700 people died, and those were in the numbers reported yesterday. And the real worry is, though, that these numbers, the death toll, might actually be far higher than is being reported, because if we look at the situation on the ground, there are a lot of crematoriums, particularly around Delhi, where they're saying they're being overwhelmed with the number of bodies coming in. It's very difficult for families to get a spot for their loved ones. There have been these mass cremations, reports of crematoriums even using the parking lot because they're just so short of space. So that leads to the suggestion, well, experts are saying, medical experts are saying, that they do believe that both the number of coronavirus cases that are being reported officially and the number of deaths on a daily basis, although those are extremely high figures, those are not really telling the full story, that there are actually far more cases of COVID-19 infections on a daily basis that are going unreported, and also a lot of deaths where perhaps the death is not recorded properly when the documents are created, or in rural areas it can be difficult to track the data and everything. So they're saying there are various reasons behind this, but certainly they believe these figures are higher than what we're actually seeing.
Rebecca, I've got the good Dr. Jha. I think you're back online, and I see you. Yes. You want to make a comment about what Rebecca just said, that the numbers might be so downplayed or under-recorded?
Not really, not really. See, there are two factors in this. One, that India has got a very robust system of the present testing. The testing is going on. The moment testing happens or any death happens related to corona, it is reported to the ICMR, Indian Council of Medical Research, and no one can escape from there. So as far as the reporting of the cases are concerned, we are absolutely firm. Yes, there is one small factor, that if any particular state in India, if they are not carrying adequate tests, that is the state matter, that there is some small bit of problem there. But there is absolutely no underplaying. No one can underplay it. because the moment anyone tests positive, it goes to the ICMR and reflects onto the national helpline. So I'm absolutely firm about that. Death cases also. Yes, it is possible that it is being underplayed. I will be slightly skeptical, but it is being underreported, possible.
Okay. You make the point, Dr. Jha, that maybe it's possible, but unfortunately we had an issue with your connectivity and now we've run out of time. I want you, Dr. Jha, very brief to say, what's the way forward? What's the best way forward for India now amid this crisis?
The best way forward is go for a lockdown on the city basis. Any city where the health infrastructure is falling short of the requirement, go for the lockdown onto that specific city on the micro level.
Okay.
Because the entire nation cannot be locked and must not be locked.
Okay,
so
thank you very much, Dr. Jha. We've run out of time. We have to leave it there. Thank you very much, Rebecca Bandun, our correspondent in Mumbai. The situation is really indeed dire. You can hear from that. There's a big crisis in India, and action has to be taken urgently to save lives.